Hello everyone. I am Dr. Jayanth Reddy, a senior consultant in hepatobiliary surgery and multi-organ transplant at Apollo Hospital, Bangalore. Today I'll be briefly talking to you about pediatric liver transplant. Pediatric liver transplant is a niche subspecialty in the domain of abdominal organ transplant. The pediatric liver care team is a comprehensive team comprising of pediatric hepatologists, pediatricians, pediatric intensivists, transplant surgeons, and interventional radiologists. The main goal of this team is to care for and treat patients with liver diseases and prevent the need for a liver transplant. Unfortunately, a minority of children present to us with end-stage liver diseases, acute liver failure, not responding to aggressive intensive care treatment, advanced liver cancers, and certain rare diseases like metabolic liver diseases. The burden of these diseases in India is high, and the only curative treatment option for these patients is to consider a liver transplant. When children need a liver transplant, in most instances, either one of the parents or grandparents come forward to donate a portion of their liver, which is usually about 10 to 20% for their children. These children do remarkably well following a liver transplant. Their recovery is quick. They are able to regain their growth, go back to school, and continue to lead a normal life, progressing onto adulthood. Throughout this period, they need constant support and follow-up to ensure that we manage any potential problems that arise. In India, there are a number of crowdfunding platforms and CSR initiatives which help and support the families of these children to raise funds and thereby making transplant both accessible and affordable to these families. Pediatric liver transplant is an extremely gratifying procedure and provides an immense sense of satisfaction once children recover from their liver diseases and get back to a normal life. The first ever pediatric liver transplant in the world was done 56 years ago, and incidentally, the first pediatric liver transplant in India was done at Apollo Hospitals 25 years ago on a child who was 1.5 years old. And this baby has now grown and is pursuing to become a doctor. Nothing can be more satisfying to a transplant team than this. Thank you.